Hey everyone, it's me, Nicole, and while I have the house and it's quiet and I'm by myself, I'm going to go ahead and film a couple of vlogs back to back. I hope you guys don't mind. I'm going to be wearing the same shirt. My hair is going to be the same. Yeah, so I hope you guys don't mind. Anyways, I wanted to come in here and talk to you guys, give you guys a little update about Sadie's hand. We had another check-in with her orthopedic surgeon just to check and see how things are going. I will put a link in the description box below to just some other videos I've done about her hand, so you guys, if you're interested in finding out her history about that, you can go and check those out. But for those of you guys that already know, I'm just going to go ahead and explain, an update to you guys. So first off, the entire time that we've known about Sadie's hand, like from the very beginning, whenever they saw her in utero and things like that, they didn't know what to call, like they didn't know what to diagnose her with. And then she was born and they still kind of didn't know what to call it. They were calling it radial dysplasia, they were calling it radial club hand. And so we kind of just got in the habit of calling it that. Like we called it radial dysplasia, and all of my videos are called radial dysplasia, Sadie living with radial dysplasia, toddler living with radial dysplasia, and that's just kind of what we've gone with over time. And as she's gotten older, she's had tons of x-rays and things like that. She's had surgeries and all that, but we've never really touched on what her diagnosis really was. And I've done research and things like that, and every time that I've done research, data stating that aplasia, just the word aplasia, means like without the bone. So basically radial dysplasia means that she did not have a radius, but she does. We've done all these x-rays, so we know she has a radius. It's just not as long as her ulna. So when we went in for the checkup, one of the things that I asked the doctor, just really casually, was, what is her condition actually referred to? Like what is the actual name of what she has? And he said radial dysplasia. So basically something just didn't develop correctly. She still does have a radius. It is not absent, it is there, so it's dysplasia, not aplasia. So now I'm trying to decide whether I should go back and change all of my old videos over to radial dysplasia, or if I should just leave it, because that's part of the journey. We did not know what this was called until just now, 3.5 years later. She is 3.5, and we're just now learning that it's radial dysplasia and not radial aplasia. So yeah, and I wanted to talk to you about the fact that there is not a lot out there about radial dysplasia or radial aplasia at all. I have searched and I've done as much research as I can, and there's just not a lot out there, and that is partially one of the reasons why I started this YouTube channel to begin with. Is there wasn't anything out there whenever we were pregnant and so scared, and we were just typing things in to see what Google came up with, what YouTube came up with. There just was not a lot out there, and so it really helped us in the hospital when one of our NICU nurses, her daughter actually had radial dysplasia, both of her arms, and she did not have an ulna or a radius at all, so she had true radial aplasia, and she was actually 3 or 4 years old at the time and had gone through all of the surgeries, and so we found a lot of comfort into getting to know her. And so that is partially the reason why I do share this story, is because maybe you are a person who Googled radial dysplasia or radial aplasia and you want to know what a child with that condition looks like, what their life is like. And so that's partially why Victoria's Heart became a channel. And there's other reasons too, but that is partially it. So anyways, on to the update. The doctors, they took some x-rays of her. They wanted to see how, to make sure that the bones were growing straight, and if she wasn't wearing her splint, her hand could start drifting again, because those muscles are strong, and without that radius there to keep the muscle as it should be, it would be very easy for the muscles to pull that hand right back over, and for all those surgeries to be worth nothing. But we are super diligent about keeping that splint on. It is always on. Every once in a while she'll take it off for an hour or two, but other than that, it's always on. And the doctor could really tell. He said, this is perfect. The results are exactly as we would hope to see the ulna is widening at the end to support her wrist. Normally your radius supports your wrist. Your ulna is thin at the top and it widens towards your elbow, and your radius is thin towards your elbow and it widens towards your wrist to support your wrist and mainly your thumb. So since she doesn't have that long radius, they position the hand on top of the ulna, and now the ulna is widening to support her wrist, and it's amazing. It's just all so awesome to be a witness to that, you know, they did the surgery and we're hoping that everything, you know, developed as it should with the alterations that have been made, and everything is going super, super well. I was kind of embarrassed because, actually I'll show you guys. Okay, this is really embarrassing. But this is her old splint. See how disgusting it is? Focus. I mean, she's worn this for a year, I will say. And, I mean, you can tell just how ratty it is. There's like a crack right there. I mean, it's really, really beat up and really bad. I mean, we've bleached this thing. We've done as much as we possibly could to keep this darn thing clean. And so whenever we went in and the occupational therapist and the orthopedic surgeon are looking at it, I said, you know, we try to keep it clean. We're trying to do everything that we can. And they said, no, this is exactly how that splint is supposed to look, because that means that she's wearing it. They said that they actually get really concerned whenever they see a really super clean and nice looking splint, because that oftentimes means that it sits on the shelf most of the time until they have to come to an appointment, and then they just grab it, put it on really quick. So this is no longer a splint that we're using. They hooked us up with a new splint, so she's got a nice little lavender splint now that she really was excited about. She's still using the nighttime splint. There really hasn't been much change in her finger. It's still really, really stiff. So that's kind of, you know, it may or may not get any better over time, but that's okay. Yeah, and they were really just really happy with how things have been going, and the next appointment we have is actually in a year. No more 6 months. We are going once a year now, so that's really cool. But yeah, so if you guys have any questions, if you yourself have radial aplasia or radial dysplasia or anything like that, or if you're pregnant and you just found out that your baby may or may not have this condition, or if you just have any questions for me in general, please feel free to leave a comment below or direct message me, whatever the case may be. Find me on Facebook. I would love to talk with you. I know that one person had messaged me on Facebook and it went into like a different folder. It didn't go into my like notifications, so I didn't know that the person messaged me until like a month or two later. And if you're watching, I am so supremely sorry. I have replied to you back since then, but I am so sorry. I didn't realize that if we aren't actively friends, that it goes into a different folder. So I will be on the lookout, and I will make sure that if anybody messages me, I will get back to you as soon as I possibly can. Again, I apologize if you're watching this and you sent me a message and I didn't get back to you right away. But yeah, if you have any questions, or if you just want to talk, if you want to find out more about radial aplasia, radial dysplasia, now that I know it's radial dysplasia, I can start calling it radial dysplasia, but I'm so used to calling it radial aplasia. We are always happy to answer any questions that you have about that topic. So yeah, that's the story. If you guys would like to, you are always welcome to subscribe and follow our journey, and click thumbs up if you like this video, and leave a comment down below, and I will see you guys for my next video. Bye!